Alright guys, I just finished passing out your anticipation guide for today that we're going to start with for the lesson. As you see up here on the board, the goal of today's lesson is for you guys to develop an understanding of attention deficit hyperactivity disorder, also known as ADHD. You probably heard of it before. You may know somebody that has this disorder, and if you do, I'm going to give you an understanding of it, characteristics, ways that you can teach somebody with ADHD, as well as ways to effectively incorporate them into general education. So you guys are going to be teachers at some point. You will probably deal with a child with ADHD, and this will give you a little bit of an understanding as to how to make that effective and how to put teaching strategies into your lessons so that you can help them be successful in their classes. So we're going to start with the anticipation guide, just to see what you kind of know already about ADHD. We're going to go over this PowerPoint here that kind of gives you the background and the understandings, and then we'll have a classroom discussion to see what you learned. And then at the end, we're going to wrap up with an anticipation guide, same one, but just finishing what you learned. So this will be what you already know or what you think you might know. We'll give you the bulk of the lesson here, and then you'll finish up with an exit ticket telling me what you learned from this lesson. So, attention deficit hyperactivity disorder, also known as ADHD. What is ADHD? It is not considered a disability under the IDEA, and because of that, there's no legal or federal definition. But under the Diagnostic and Statistical Manual, it classifies this essential feature of this disorder as a persistent pattern of inattention or hyperactivity, impulsivity that interferes with functioning and development. This indicates that an individual with ADHD must display characteristics that are persistent, frequent, and severe. So keep those three words in mind: persistent, frequent, and severe. This is a brain of a control subject and an ADHD subject, so it kind of shows you the difference of what's going on in their brain. The prevalence of ADHD. On average, in a classroom this size, 30 to 35 students, at least 2 of you would have ADHD. Between 3 to 5 school-age students have ADHD, making it one of the most prevalent categories of exceptionality. The prevalence of this disorder does appear to be gender-related. And research shows that the individuals with characteristics in adolescence, so young people, carry these into adulthood. So it's not something that fades away. It is something that you can cope and manage with throughout your lifetime. It might be something that fades over a long period of time. You don't have as severe of symptoms, but for most people, it carries 70% of children carry this disorder into from adolescent to adulthood. There are different types of ADHD. So we have predominantly hyperactive and impulsive. We have predominantly inattentive, or a combined of the two, hyperactive, impulsive, and inattentive. So there are some characteristics that go along with each. If you are predominantly hyperactive or impulsive, you might fidget, have difficulty engaging in leisure activities, difficulty waiting your turn, excessively talking. Predominantly inattentive, you may have a hard time paying attention to your schoolwork, may not be listening when you're spoken to, and may be easily distracted by extraneous stimuli. And if you're a combination hyperactive, impulsive, and inattentive, you kind of have a lot of those characteristics going on. And this is just a picture of the primary effects of the cognitive and social functioning within the classroom, what's going on in their brain: emotional outbursts, daydreaming, forgetfulness, low confidence, lack of friendships. So you can be socially affected by ADHD. There are causes of ADHD. While some people think that there's a lot of myths, bad parenting, diet, poor eating a lot of sugar. There are things that people think cause ADHD, while we've developed research that showed neurologically based disorder. That means it comes from your brain. So genetics, genes are responsible. the neurotransmitters in your brain are particularly dopamine may be involved. Your brain, so the prefrontal lobe and the cerebellum are considered areas affected by this disorder. There are no credible theories that say social or environmental impacts cause this. And some factors that may include premature birth, maternal smoking, alcohol use, and exposure to lead, according to the U.S. Department of Education. So there are a few different causes. Genetics and the brain are the primary causes. There are new medicine discoveries and medicine discoveries that have kind of gone on for a few years now that help people with this disorder. So if you have ADHD, you might seek counseling, go to a doctor, talk to them about what's going on. They may prescribe you some of these medications that are called stimulants or non-stimulants. They are effective in treating students, individuals, anybody, children with this disorder. They may lead to better choices of matching potential responses to specific characteristics of an individual. So depending on who the individual is, stimulants or non-stimulants may be more effective. There are various ways of treatment, training, guidance, doctors, anybody that is going to be able to help these people get through their daily lives and be successful like anybody else that might not be living with ADHD. There are a lot of teaching strategies. So the instructional content, self-regulation skills. The goal of any of these programs is going to be to improve attention, task completion, and academic achievement. Academics, learning the curriculum, students with ADHD may need to be taught specific strategies. So organization skills, goal setting, improved listening, attending skills, and aiding and following instructions are what we want to increase and improve in someone with ADHD. A 504 plan, which you guys have all learned about in this class, may be implemented for somebody with ADHD, although some ADHD students are not eligible for special education services. The Vocational Rehabilitation Act of 1973 has become a more global vehicle for accommodating these children. So that act made it better for kids within schools with ADHD to get the treatment that they need and the teaching strategies. This is a plan, as we know, that outlines the academic needs that will be implemented in the classroom. Physical, instructional, and behavioral accommodations may be made in order to help this individual with ADHD. A lot of self-regulation and self-teaching. So self-assessment, self-evaluation, self-monitoring, and self-reinforcement are all skills that maintain a goal and positive goal-oriented way of keeping yourself on track if you're somebody with ADHD. It will help them to perform desired behaviors, be consistent, and have self-control when they're in the classroom and then when they're without the classroom, outside in the everyday world. There are some family and community resources such as parent training. It may be difficult to deal with a student or a child within your home that has ADHD. So systematic behaviors, teaching their children to positively interact, explicit, symptomatic, externalized, compelling forms. So rules, instructions, and consequences will be implemented for children with ADHD. And these are some family and community resources: Greater Baltimore Counseling, Oasis Mental Health Center, and Johns Hopkins BMC, that will provide the services that someone needs if they're dealing with ADHD, and help them with coping through their everyday life. And these are my references used for the PowerPoint. So let's wrap it up with a discussion. What did we learn? What did you guys already know? And what can we gather from that in order to finish our anticipation guide and for you guys to be successful one day when you do teach someone with ADHD?